In Vietnam, I was a frontline infantry soldier. I had never, to that point, ever even been in a fist fight in my life. To prepare one to be in a position to take or not human life is a very confusing and difficult proposition. For many years after I was released from Vietnam, I wandered about mentally, aimlessly, and suffered from the disease of alcoholism. I was not discussing the ramifications of Vietnam on me physically and especially mentally. I sought this campus, the VA, out for recovery, rehabilitation. I came, I saw, and they conquered. The VA had changed.
We really define patient-centered care as providing the most positive patient experience in a healing environment each and every time we interact with a patient and their family.
To me, it goes back to putting the patient's needs first and also anticipating their needs. Paying attention enough to remember that this is a whole human being in front of you, and really treating them like they were a family member. Or if you were in that bed, how would you want to be treated? If your family member was in that bed, how would you want someone to treat them?
Both feet were suffering tremendously from arthritic conditions that had deteriorated over the years. They wanted to remove my cervical vertebrae, my neck, if you will, and insert a titanium rod. I could not see how that was going to be done without a lifetime of pain pills. However, the VA offered alternatives, which I was willing to try.
A lot of our veterans who are in pain are saying, can you give us acupuncture? Can we do Tai Chi? That's a much more effective approach for me. So it's really coming up with a plan of care that is very personalized, that the patient kind of agrees to, I'm going to be engaged in this. In order to really move forward, there are two things that I think you need to do. One is I think you have to build the change into your structure and make it part of what you do every day.
So between Tai Chi, acupuncture, yoga, ultrasound, and other chiropractic practices, between all of those things, ever since 2009, I have not had to take one prescribed pain pill for any particular reason.
Mr. Sells' story is so touching, and every time I hear it, it brings tears to my eyes because it's so profound that he was lost and came back to the VA. It also reminds me that to keep offering these healing opportunities for patients, it's an opportunity to bring in patients who maybe have not been at the VA for a very long time. So on many levels, it's very inspiring and encouraging and a good reminder to keep going and keep piloting and to keep reaching out, offering healing opportunities.
What the patient remembers most is how they were treated and how we interacted with them. So to me, the absolute building block to patient-centered care is human interactions and relationships. And if you don't have that, I don't care what you have, you're not going to have good patient-centered care.
What has happened to me in the last 4 years has really restored my faith and removed all my skepticism about the military and the U.S. and how we were treated, and I am hoping, praying that other veterans who I know are walking the streets in anguish and also in fear, who are suffering from diseases and ailments that are associated with their involvement in Vietnam, that some way, anything that I can do to reach them, to let them know that the nation has heard, the government has responded, the VA has changed, and the services are here